Welcome to the FUMS Now podcast show, where you'll gain information, inspiration, and motivation for living your best life with multiple sclerosis. Find us online at FUMSnow.com. Now, here's your host, Kathy Reagan Young. Hey everybody, thanks for joining me on the FUMS podcast show, where we give MS the finger and tell it FUMS every day. Today, I'm bringing you some groundbreaking information. There's finally a definitive diagnostic test for MS. It'll no longer be a diagnosis of exclusion, and it'll possibly no longer be a diagnosis that has to include a lumbar puncture. Woohoo! Great news. Get this, it's a simple blood test that can give the answer with a greater than 90% accuracy rate in just 1 week. This is big. I'm talking with Chase Spurlock and Julia Polk of IQuity, Inc., the biotech company responsible for this amazing technology. So let's get into it. So Chase and Julia, thank you so much for being with us today on the FUMS podcast show. Welcome. You've got some big news to share in terms of new diagnostic tool for MS, the first of its kind. It's really exciting stuff. But first, if you don't mind, if you would please just give me a little background on each of you, and so we get to know you a little better.
So I appreciate you having us on your show, and very exciting time at IQuity. I'm Chase Spurlock. I'm a PhD in microbiology and immunology from Vanderbilt, where I also serve on the faculty, and I'm the CEO of IQuity.
And I'm Julia Polk. I'm the Chief Strategy Officer and CFO of IQuity. I started my career in investment banking on Wall Street about over 30 years ago, and have worked with a number of early stage companies in Nashville. One was called Corporate Childcare, became Bright Horizons, which is in the employer-sponsored childcare space, and then a company called Change Healthcare that delivered cost transparency to patients. And so this is my third time around. I've worked with over 100 early stage companies. My role is in finance and helping build a business, set policy and procedure. So that's what I do with Chase.
Wow. Okay. So we've established you're both very impressive people. And we're glad you set your sights to help in the MS realm. So, I've learned a bit about IQuity and about this test, this diagnostic test, which, again, first of its kind, so exciting for those of us in this realm, particularly looking for those folks behind us, not yet diagnosed, knowing what that often takes. So, if you could give us just a little bit, were you looking for a test, a diagnostic test on MS, or how did you come to find this?
Well, I think that it all started, at the completion of the Human Genome Project. And, so this, speaking as a scientist and as, one of the co-inventors of the technology, we have these maps of the human genome, and we wanted to explore, what the genome was doing in the context of disease. And because we're immunologists, the big bad wolf in immunology is autoimmune disease. So how does autoimmune disease come about, and what does the molecular portrait of disease pathogenesis look like? So I think we began to, decode the genome and look at the different expression profiles that are found in different autoimmune diseases. And what we found is that, all autoimmune diseases share similar expression signatures, but different autoimmune diseases have very distinct profiles within the autoimmune signature realm. And, through collaborations with groups like the Accelerated Cure Project, as well as clinical collaborators that we've worked with for years now, we were able to collect, excellent specimens and excellent blood samples from patients with multiple sclerosis. And this, fueled our discovery pipeline to be able to produce a test that's highly accurate and can be used at the earliest onset of symptoms.
That is fantastic. It's a blood test, right?
So right, so it's not a lumbar puncture. It's a simple blood draw. So a phlebotomist puts a needle in your arm, and then we collect a couple tablespoons of blood, and then that gets shipped to our lab, and then we do our analysis, and then the results get reported back to the provider. So your doctor still has to order this test, so it's not a direct-to-consumer test. Okay. But yeah, it's a pretty simple process, and we can return the result in as little as a week.
Holy cow. That sure will be revolutionary in this diagnostic world. And how accurate is the test?
So in our research, we found that our ability to make a positive or negative determination, a yes or no call for multiple sclerosis, is greater than 90% accurate.
Wow.
And when we've tested this in multiple sclerosis patients at various stages of disease, so clinically isolated syndrome patients that go on to transition to clinically definite multiple sclerosis. We've looked at patients at the time of diagnosis, and then we've looked at patients with established disease, and then compared those patients and our calls there to other inflammatory and non-inflammatory neurologic diseases that a neurologist would typically see. These are conditions like optic neuritis or transverse myelitis or neuromyelitis optica that have an inflammatory component. And then we've strengthened our call by looking at Parkinson's and Alzheimer's and dementia, which are non-inflammatory neurologic diseases. And we find that the calls we make are very specific for multiple sclerosis.
Fantastic. Will this be an independent test used to diagnose MS, or will it be, an additional test sort of in the arsenal of testing that docs use for MS? Like you mentioned the lumbar puncture, everybody's favorite, and MRIs and that sort of thing.
Yeah, I think that, you have to look at the history of multiple sclerosis and the diagnostic criteria for MS. So, we've gone from clinical assessments alone to use of evoked potentials and spinal fluid analysis to, in the early 2000s, the inclusion of the MRI. And, that as a tool revolutionized the entire field.
Right.
And so, I said in an interview most recently, I viewed 2017 as the inclusion of yet another link in the chain, and that's looking at the molecular portrait in the patient and looking at the RNA. And I think it has to go hand in hand with the existing tools. We're not going after the MRI. We're trying to give doctors another tool that they can turn to in those difficult to diagnose cases, or when they can't say definitively yes or definitively no. And, disease in its earliest stages is difficult to call. And there's a great report put out by Brain Health Time Matters in MS talking about and preaching, early diagnosis, early treatment leads to the best long-term outcomes. And, we believe that our tool will allow doctors to get to that early diagnosis point faster than is conventionally possible. Right. And that in turn allows the patient to receive treatments which are highly effective and mitigate the long-term damage that's associated with MS and it's disabling.
So important. So does this test allow sort of a differentiation between the types of MS, the relapsing, remitting, primary progressive, secondary progressive, or just that MS is present?
So right now we've focused on a yes or no determination for multiple sclerosis as a broad category. And, we're interested in, and we're actually currently researching relapsing, remitting multiple sclerosis versus primary and secondary progressive MS. And one of the reasons why we're not making that determination today is that the clinical criteria for what exactly is primary progressive or secondary progressive has kind of been, for lack of a better word, fuzzy over the last decade. But I think you're seeing that those clinical determinations can be made, and we're actively recruiting samples from these individual categories, and we're going to continue our analysis to see if we can give yet another indication about when a patient may transition from relapsing remitting to primary progressive, because having been at all these conferences over the last year, we now have our first drug for primary progressive MS and it's a very exciting time.
It is.
And these anti-B cell therapies, that's all anybody wanted to talk about last fall at ECTRIMS, and then that's persisted throughout the year at ACTRIMS in Orlando this past February that Julie and I both went to, and then at AAN in Boston just last month.
Great. Do you see this being used in confirmatory testing? In other words, those of us who already have a diagnosis, would there be a use in confirming that diagnosis? I'm always surprised at the number of MSers who question their diagnosis. I mean, it's understandable given that this has, up until now really been sort of a diagnosis of exclusion. But will you be marketing it for that purpose or just for new diagnoses?
Well, I think you bring up an excellent point there, and it's one that we probably didn't appreciate. And I could let Julia comment on this too, but I think that we've developed a test where we've looked at multiple sclerosis patients across the entire spectrum, those with established disease and those at the time of diagnosis and before diagnosis. And I think that what we have here is a molecular portrait that's distinct for MS, and it can be used during the whole spectrum. So we've tested established multiple sclerosis patients to be able to say, even after being on therapy for a period of time, this is still a molecular portrait that's indicative of MS. How about you talk about a little bit about what Jarrett's, so Jarrett Smith, who's our head of sales, he's been in the field and he's made a number of different observations. So I don't know.
Certainly, when you think about MS and what we know about it as we read the research, listen to presentations, there's a high misdiagnosis rate in MS. It's reported to be as high as 35%, 5 to 35%, depending on the researcher. And that's a significant number of people. Yeah. And yet, as we went to market, we didn't imagine that the existing diagnosed patient population would be a testable population until we met with providers. And our experience there, Jarrett's experience there, is that they have patients in their practices that they may have inherited from another doctor. They didn't do the diagnosis themselves and are questioning the diagnosis, or the patient is questioning the diagnosis. So we've got a number of people in every one of these community neurology practices that have a wish to be tested just to confirm that the diagnosis they've had for a short period of time or a long period of time is in fact correct. And we're hearing that not only from patients, but also from doctors. And that will be an opportunity for us to provide this test to a whole lot of people. There are, as you know, probably there are 400,000 diagnosed MS patients in the U.S. alone. So when you talk about 5 to 35%, that's a large number of people.
It is. How about for first-line relatives of MSers in terms of predictive testing? We were on a conference call recently together, and Chase, you said the immune system sees things before the physical manifestation of the disease. So, for instance, could I have my daughters tested to know the likelihood of them developing MS?
Well, I think that, the way we've engineered this test is that it's an actionable test. If you talk about predictions, those are more like genetic association studies. And, one of the points that I try to communicate wherever I go is that looking at changes in your DNA, are only good for predicting if you might have a disease later on in life. So, like, one of the risk alleles, for rheumatoid arthritis, a large percentage of the women in the United States have it, but, an overwhelming majority of the women in the United States don't have rheumatoid arthritis. So you have to distinguish between, a prediction and what's actually occurring in the body, and RNA allows you to do that. It's a measurement of what's actually happening in the body, because it's breaking down the communication that's happening inside the cells of the body, and in our case, in the immune cells, the blood cells of the body. And so I think that, back to how we engineered the test, it has to be actionable. Your doctor has to have a reason to order the test. There has to be signs and symptoms
sure.
that would make the doctor include multiple sclerosis in their differential diagnosis. So therefore, they have a good reason to order the test.
Sure.
So we don't look at this as a screening test. It is really meant to be an actionable test, and the information needs to be useful to the doctor to have clinical utility for him or her to make a change in the process of diagnosis.
Okay. When will the test be available?
We're going to start taking our first orders at the end of this month. And we'll look to begin processing blood samples in June and reporting our results back to the doctor. So it's a pretty exciting time.
Coming online quick. That's great.
Yes.
Oftentimes we have to wait so long for things, and I know this did not require FDA approval, correct?
No, we did not go that route. We are not required to go that route as long as we develop, market, and perform the test in a single laboratory. So we're regulated under the CLIA law, which is part of CMS, and we are not required to go the route of FDA approval. Should we decide to distribute our test differently in the future, meaning among many labs, we would have to go that route, and it's not off the table, but it's not required for us to go to market.
Okay. Hence, it came to market quick. Is this test covered by insurance in the U.S.?
It is not yet covered by insurance in the U.S. It is the high priority for us as a team to achieve payer reimbursement. And we were just on a phone call before we talked to you just now with a group that's going to help us achieve that. We've begun that process of developing the evidence, and we intend to do everything in our power to get to all of the payers and to find a way to make this reimbursable by payers as quickly as possible. So it is a patient-paid test. We will take credit and debit cards through a portal, and we will be able to, over time, shift that over to payer reimbursement.
Okay. So how much will it cost, and will there be patient assistance available?
Good questions. It's really important to us that this test is made available to as many patients as possible. So we're very aware of the impact of a high-priced test. Most tests like this in the market today are priced in the $2,000 to $5,000 range. Mm-hmm. A lot of those are in cancer. We recognize that is a lot to bear for patients, and we intend to offer patient assistance for financial discounts that would bring that test price in the range of $1,250 if you were eligible for the full level of discount. Okay. And so we also look at how does that compare with the alternative. What are you spending if you are going out of pocket for any of the other services that might be used to determine a diagnosis, particularly if you are in your second or third MRI, or you've had your spinal tap, you've gone back for another MRI. And our pricing is well within the range for those things that are from $3,000 to $5,000 as well.
Okay, good. Is this test being offered in other countries as well?
Right now, we're focused in our United States launch, and we're actually getting a number of inbound calls from, Canada as well as Europe asking about the test. And, I think it's our goal that it be made available to as wide an audience as possible. But, there are regulatory considerations, sure. and we're actually working through that right now.
Okay. Well, you'll probably be hearing from more because we have a large contingent of international listeners. Excuse me, I know you've been rolling this out at various conferences. So what has the reception been like for this test?
I would say that the common theme is this, that any test, even a blood test, that can help a doctor or a provider confirm a diagnosis of MS would be of clinical benefit. And I think that there's an appreciation that there is misdiagnosis in this field, and that the other complementary tools beyond the MRI are invasive. The spinal tap is an invasive process.
It is.
So having another option to turn to with the MRI would be of enormous clinical benefit, and would be something that many of the doctors that I've talked to would be very interested in.
Yes.
So it's a discussion of their toolbox, and putting another tool in their toolbox that they can leverage in their clinics.
I would think a lot of patients would be very interested too, particularly if it meant not having to do that lumbar puncture. I don't think you're suggesting that necessarily. It's just another tool and maybe to be used in conjunction with. But I have to think that some MSers or potential MSers are just so scared of that they're, probably staying away from the doctor, waiting longer than they should. So it would be, that's just my 2 cents worth. That was one of my biggest fears was having to have that thing done. So,
Yeah, no, you're absolutely right. And some of the doctors, especially those we've talked to locally, they would love to substitute, the blood test for the lumbar puncture.
Yeah.
Because they're heavily relying upon the MRI and then the clinical signs and symptoms and their experience. But then if they could have this confirmatory test or this secondary test that would then allow them to say yes or no, that would be a bonus for them.
Absolutely.
Because it's a bonus for them and it's a bonus for the patients.
Yes.
Agreed. So I know IQuity has other, first of all, this is called IsolateMS, correct?
Yes.
And I know you have other Isolate tests coming online as well for, rheumatoid arthritis and IBS. So in the rheumatology and gastroenterology realms. So unfortunately, MSers often have other issues as well, and perhaps one of these tests will be appropriate for them too. So if you could please just give us a little information on those additional tests that you'll be offering.
Certainly. We are working already on the clinical validation for our gastroenterology test, which will focus on distinguishing between IBS and Crohn's or colitis, which are the IBD diseases. And so that process is well underway, and we hope to have that test on the market in a couple of months after we launch the MS test. We're finding similar sorts of results in our R&D lab. We have to perform those in our clinical lab as well. But we recognize that there's a crossover with all of these autoimmune diseases across these three disease categories: neurology, gastroenterology, and rheumatology. When we talk about our rheumatology test, we will likely focus it more on the definition of fibromyalgia, because fibromyalgia is often confused with, as are many of these diseases, confused with other diseases. And so part of the process in treating a patient with fibromyalgia is to identify whether or not they have RA or lupus. So part of the differential diagnosis there is to determine which of those three things is going on at the molecular level in the patient's blood, because it will be an indicator of the disease state. So that is expected to be out by the fall, and so we'll have 3 Isolate tests on the market, we hope, by October.
Fantastic. Well, congratulations with everything, and thank you so much for your diligence in looking for these tests and pushing the science forward. And from a patient's perspective, thank you for hopefully eliminating the need for the lumbar puncture. As I said, that scared the heck out of me when I was waiting on my diagnosis. So I just want to thank you both for being with us today and sharing this information, and thank you for taking the time out to explain it all to us. And we'll be watching as this continues on the rollout, and very expectantly waiting for all the good news.
Thank you, Kathy.
Yeah, thank you, Kathy. And it's because of patients like you and others that are looking to give back that that led to the creation of this test. So, we want to thank all the patients that participated in the studies, and all of our partners and clinicians that helped fuel these studies. So, if you're out there and you participated, want to say thank you.
I agree. And thank you from all the FUMSers as well. So thanks again for being with us. I really appreciate it.
Thanks, Kathy.
You're welcome.
Okay, that was great. Thank you all so much. I do really appreciate you all taking the time to do this interview with me today.
No worries. It was fun.
Yeah, no, appreciate you having us on.
Excellent.
So what regions would you say are the most unexpected that you have a large following? So you talked about Europe, but
yes, in particular, excuse me, I hear from an awful lot of people in Scotland and Ireland. I every now and again I get some kind of, and I don't know why, but some sort of burst of emails from India, which is interesting. So I don't know if it's that, someone discovers my podcast and then shares it. That's the only thing that I can come up with. Excuse me. But in particular, and also a lot of people from Canada, but particularly I would say Scotland and Ireland are very vocal and, have a very high percentage of MS, unfortunately. So I guess it shouldn't be that surprising. But
What about like Scandinavia? Do you?
No, I never hear from them.
Interesting.
Don't
Okay.
hear a thing. Yeah, it is interesting.
And I do think we will figure out the methodology to work with patients outside the U.S. once we're live.
Mm-hmm.
But there's some logistics, legally and otherwise, that we have to go through to get an assurance that we can get the blood across the ocean and keep it as cold as it needs to stay to get to us. So there's some things we have to work out.
Sure.
I don't want to say that's forever away from now, but we've got to deal with the logistics.
Mm-hmm. Understandable. I used to, I was a pharmaceutical sales rep in another lifetime. So I'm somewhat familiar with some of the logistics of what you're talking about. I was involved in several launches. So, yeah, I have kind of the perspective from both sides, which is interesting.
That's helpful.
One of the reasons that I started this page was to help people maybe understand a little bit about the procedure and why we're having to wait so long for things and that sort of thing. Put it in, layman's terms. So
I'm curious, Kathy, how hard you think it's going to be for a patient to walk into their doctor with our brochure and say, "Hey, you've never heard of this before. What do you think about ordering this test for me?"
Well, I think in particular, I find MSers really engaged and really doing a lot of research. But again, here's where my other side of the perspective comes in. I found that it would piss doctors off to have people coming in. Well, there were two sort of sectors. Either it pissed them off, or they were open to it and grateful for it because maybe, they weren't keeping up with all the literature or whatever.
Yeah.
But an awful lot, now this was, again, a while ago, so take that for what it's worth, but an awful lot of times I would see these doctors, they would talk to me after a patient would leave and they'd say, "Oh, God, these people are oftentimes drug companies. They're advertising on TV and in the magazines, and my patient comes in and talks to me about this, and they just come in adamant. They want this done, and I don't think that that's appropriate, but they're going to bulldoze over me, and so I feel, pushed up against the wall on this, and so I have to do it." But again, that was years ago. I think things have settled a bit. But your original question about how tough would it be, I don't think it's going to be tough for MS patients. I think they're really an engaged group. And I think they're looking, particularly those, I think, that are going through the process of getting diagnosed. The first thing they do is hop online.
Yep.
So, I just harken back to 2008 when I was going through this. And again, that's a whole different reason why I started FUMS, because everything I saw was horrific. I mean, pretty much pick out your wheelchair. That was it online. It was really scary stuff. And at that time it was, I had to wait several weeks even to get an MRI, and then I had to wait weeks for it to get read, and then more time for a lumbar puncture, all of that. So it gave me plenty of time to work myself into a lather over everything I was seeing online. But I just harken back to that time, and had there been anything that was online, believe you me, I knew about it. I was on it 24/7. That was sort of my full-time job while I waited. And I would have been so happy to go in with any kind of help for getting this diagnosed, because, the worst place to live is limbo. I mean, just tell me so I know what I'm fighting here. And that was a long process for me. And frankly, mine was very short. It seemed long, but I talk to people every day who have waited years.
Right.
I can't even imagine the stress that must cause, not just the patients, but the families, friends. It's so I think this is revolutionary and so exciting, and I absolutely think patients would be happy to walk into their neurologist and say, or even their primary care, and go, "Look, we've been playing with this for a while, but look what's available."
Yeah, that's what we believe too. So I was curious about your opinion, but thank you so much for that.
Absolutely.
Yeah.
Sure. Well, again, thank you both for your time. Appreciate it. Looking forward to our next conversation. And if it's not before, I guess it will be in October when we see you. Can't wait.
All right. Talk to you later.
Thank you. Bye.
Bye-bye.
Thanks for listening, everybody. If you found value in this podcast, I invite you to go into iTunes, search for FUMS Now, and leave me a 5-star review. Not only does that motivate me to create more free content, it also helps others just like you to find this valuable resource. Be sure to sign up for our free newsletter for more tips and tricks for living your best life with MS at FUMSnow.com. And if you have suggestions of future topics or guests for the show, please email me directly at Kathy, Kathy, at FUMSnow.com. I appreciate you spending this time with me. Until next time, remember to speak to this stupid disease like it deserves. Tell it FUMS every day.